Hello everyone, my name is James and I'm a physical therapist working in Canada. On today's video, we will continue to talk about Parkinson's disease. We will specifically focus on how we describe the stages using specific classification systems. There are two main ways to describe the severity of the disease. The first is the Hoehn and Yahr stages of Parkinson's disease. Hoehn and Yahr ranges from 1 to 5, 1 being the mildest and 5 being the most debilitating. Stage 1 is described by mild and unilateral symptoms. Symptoms are inconvenient but are not disabling. It is likely that friends or family members notice some of the changes in posture, locomotion, and facial expression of the individual. Stage 2 is described by bilateral symptoms that have minimal disability with some effect on gait and posture, but without impairments of balance. Stage 2.5 is similar to stage 2, still showing recovery on pull test, which is a test of balance, specifically external perturbation on the individuals living with Parkinson's disease. The examiner gives a sudden backwards pull to the shoulders on the subject, and the subject is instructed to do whatever it takes to not fall. Stage 3 is described by moderately severe. It is characterized by significant slowing of body movements. You may see early impairments in balance when walking or standing, but the individual is still physically independent. Stage 4 is described by severe symptoms and disability. Individual can still walk or stand to a limited extent without assistance. The individual has significant rigidity and bradykinesia, but tremor may be less than earlier stages. For this reason, the individual can no longer live alone. Stage 5 is described by cachexia, which indicates significant muscle mass and weight loss. The individual cannot stand or walk and is completely dependent. The individual may need a wheelchair. The second method of classification is called the Unified Parkinson Disease Rating Scale, known as UPDRS. This method is more complicated than the first, as the classification is evaluated by interview, exam, and questionnaire specific to the individual living with Parkinson's disease. The scale consists of 4 sections, which are non-motor aspects and motor aspects of daily living, motor exam, and motor complications with respect to activities of daily living. The MCID, or minimally clinically important difference, is changes of 5 points. Knowing these stages and relative disabilities, we can make our goals of therapy specific to each stage. On the next video, I will go over some of the treatment options that you may consider as physical therapists if you're working with individuals living with Parkinson's disease. Again, thanks for watching, and I'll see you next time.